Shadows of our modern world, a silent threat is emerging. While we focus on viral outbreaks and global pandemics, a new enemy is quietly gaining ground. This enemy is not a virus, but a bacterium, a microscopic entity capable of causing widespread devastation. In Japan, this silent invader has already begun its assault, leaving a trail of suffering and fear. The enemy is a particularly aggressive strain of Streptococcus pyogenes, known to cause a range of illnesses. This new strain is more virulent, more resistant to antibiotics, and more adept at evading the human immune system. The result is a surge in severe cases of streptococcal infections, overwhelming hospitals, and claiming lives at an alarming rate. Unlike the dramatic onset of many viral infections, streptococcal infections can begin with subtle symptoms, easily mistaken for common ailments. This delay in diagnosis and treatment allows the bacteria to multiply and spread, often with devastating consequences. Japan's battle against this aggressive strain serves as a stark reminder of the ever-present threat of bacterial infections. The urgent need for global vigilance and action cannot be overstated. Unveiling the invader, Streptococcus pyogenes. Streptococcus pyogenes, also known as Group A Streptococcus, gas, commonly resides in the throat and on the skin. Most gas infections are relatively mild, causing illnesses like strep throat and impetigo. However, under certain circumstances, gas can invade deeper tissues and organs, leading to severe and life-threatening conditions. The strain of gas currently plaguing Japan is particularly virulent, causing a rapid and severe decline in infected individuals. This strain is associated with invasive gas infections, which occur when the bacteria breach the body's natural defenses. These invasive infections can manifest as necrotizing fasciitis, streptococcal toxic shock syndrome, and sepsis. In 2023 alone, over 10,000 cases were reported in Japan, a significant increase from previous years. The mortality rate for invasive gas infections remains high, ranging from 10% to 30%. The emergence of antibiotic resistance underscores the urgent need for new antibiotics and alternative treatment strategies. Japan's struggle, a growing health crisis. The surge in invasive gas infections has placed a significant strain on Japan's healthcare system. Hospitals are grappling with an influx of patients, many of whom require intensive care and prolonged hospitalization. The demand for antibiotics and other medical supplies has surged, leading to shortages and delays in treatment. The Japanese government has responded by increasing funding for research and implementing public health measures to contain the spread. These measures include promoting hand hygiene, encouraging people with symptoms to stay home, and raising awareness about the risks associated with gas. Despite these efforts, the outbreak continues to pose a significant challenge. The subtle symptoms in the initial stages of infection often lead to delays in seeking medical attention. The situation in Japan highlights the need for constant vigilance, early detection, and effective treatment strategies. The science behind the silent invader. The virulence of the gas strain affecting Japan can be attributed to a combination of factors. Genetic mutations within the bacteria have led to the production of toxins that disrupt the body's normal immune response. These toxins, known as superantigens, overstimulate the immune system, leading to a cascade of inflammatory reactions. Furthermore, this strain of gas possesses enhanced mechanisms for evading the host's immune system. It can produce enzymes that break down antibodies, rendering the immune system less effective. The bacteria can form biofilms, protective layers that shield them from antibiotics and immune cells. The rise of antibiotic resistance in gas is another major concern, making treatment more challenging. Personal stories, faces of the epidemic. Behind the statistics lie the human stories, the individual lives touched by this devastating infection. One such story is that of Hana, a young mother from Tokyo, who contracted a severe gas infection after a seemingly innocuous scratch. Despite aggressive treatment, Hana succumbed to the infection, leaving behind a grieving family. Another poignant story is that of Kenzo, a retired teacher who developed streptococcal toxic shock syndrome after a bout of what he thought was the flu. Kenzo experienced a rapid decline in health and spent weeks in the ICU before finally succumbing to the infection. These stories illustrate the devastating impact of invasive gas infections on individuals and communities. They underscore the urgent need for greater awareness, early diagnosis, and effective treatment options. Global implications, a looming pandemic. While the current outbreak is concentrated in Japan, the emergence of a highly virulent and antibiotic-resistant strain of gas has raised concerns about its potential to spread globally. International travel and trade provide avenues for the bacteria to cross borders and establish a foothold in new populations. The situation in Japan serves as a wake-up call for the global community. It highlights the interconnectedness of our world in the face of infectious diseases and the need for international collaboration. Combating the threat, strategies for prevention and treatment. Combating the threat of invasive gas infections requires a multi-pronged approach that encompasses prevention, early diagnosis, and effective treatment. Public health measures play a crucial role in preventing the spread of the bacteria. These include promoting hand hygiene, respiratory etiquette, and staying home when sick. Early diagnosis and prompt treatment are essential for improving outcomes in cases of invasive gas infections. Healthcare providers need to be vigilant in identifying suspicious symptoms and initiating appropriate antibiotic therapy without delay. Rapid diagnostic tests, such as polymerase chain reaction (PCR) tests, can help identify the bacteria quickly and guide treatment decisions. The development of new antibiotics and alternative treatment strategies is crucial to combat the growing threat of antibiotic resistance. Researchers are exploring new avenues such as phage therapy and monoclonal antibody therapy. A call to action, the need for global cooperation. The battle against invasive gas infections requires a collective effort from individuals, healthcare providers, researchers, and policymakers worldwide. Individuals can play their part by practicing good hygiene, seeking medical attention promptly, and getting vaccinated against common gas infections. Healthcare providers need to stay informed about the latest treatment guidelines and report cases to public health authorities. Researchers play a vital role in developing new antibiotics, vaccines, and alternative therapies. International collaboration is essential to share research findings and coordinate surveillance efforts. The silent invader is at our doorstep. The time for action is now.